Muchas gracias. Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you. Thank you so much for joining us. Once again, you can send, if you want to follow the news, especially through this holiday season, news in English and in Spanish. Follow me on Twitter, or now called X, at AM Salazar, or where I'm tweeting much more in English, which is at Mexico Daily. It's always good to hear from you. And we're now starting to broadcast and podcast these interviews on my account on YouTube. So you can also follow me there. Just put in my full name, Ana Maria Salazar Slack, and you can pick up some of the interviews that you may have not catch or listened to on our radio show. So I just want you to close your eyes and just remember what life was like, I don't know, 2 Christmases ago or two Decembers, 2 years ago. And if you all recall, we were all wondering what who was going to get sick, if we got sick, whether we were going to die, or how would it affect us in the long term. And clearly, most of us, and it was my case, we did not travel. We could not travel either because there was just not enough flights, or in my case, I would not travel because I did not want my elderly parents to get sick. And I think a lot of people suffered through those Christmases and the holiday season a lot because we couldn't be with our loved ones. So now, look around what has happened in 2023, December 2023, and we can travel. And we're even talking about getting COVID vaccines in your local pharmacy, or at least some pharmacies around the country here in Mexico, which was unthinkable. Dr. Baruch Diaz is also joining us today. Um, I remember back, and I really appreciate, Doctor, you joining us here and Living in Mexico. By the way, he's he's the doctor who's head of the travel clinic for UNAM University. I just remember talking to you 2.5 years ago, and it was just horrific what we're living through. And now, believe it or not, they're selling COVID vaccines in Mexico, although it appears that there's none left in the pharmacy. Welcome to the show. And could you just give us a sense where we are with with COVID right now and what we should be concerned about? Welcome to the show, Doctor.
Hello, Ana Maria. Nice to be here with all your audience. I am very happy because we are coming to a Christmas time, holidays, and it apparently in Mexico, everybody 5 years and old has got a shot of COVID-19. And it will be very important, this shot, because of the primary shot, because we can celebrate, we can get into our houses and celebrate with all of the beloved ones. And that wasn't possible to do 2, 3 years ago.
Right.
So they are very good news. Now Mexico is struggling to get uh, actualized, update shots of the COVID vaccine. The government hasn't buy anyone, and the pharmacies, private sector of medical attention, has to deliver to the population.
So
And
let me just ask you a question about that. So Pfizer, I mean, there was a whole stock of Pfizer vaccines that came to Mexico this week, and clearly uh, they were, at least our understanding, the way it's being reported right now, they just disappear. I mean, there was just clearly not enough to fulfill the demand. The Mexican government is providing vaccines, but there
update
has been
vaccines, not
not
update
updated.
vaccines.
No. Okay.
The
So
government,
that's the issue, right? That's the
yes.
problem.
The issue is that the Mexican government isn't providing update vaccines. They are vaccines done with the Wuhan original virus. And as we know, everybody, the CDC at the United States and the World Health Organization Expert Committee on March 2023 has determined that the vaccines done with the original Wuhan virus of COVID-19 had to be removed from the stock and replaced with the update vaccine of COVID-19, distributed and sold by Pfizer, Moderna, and Novavax. The last two weeks, the government has authorized for commercialization the update vaccine of Pfizer and the update vaccine of Moderna, both for COVID-19, Spikevax for Moderna and Comirnaty for Pfizer. But uh, it has not buy any dose by the
Those
government.
vaccines.
Every Mexican has to come to the pharmacy private sector, the physicians, the hospitals of the private sectors to fulfill this update shot of COVID-19. And that's a problem because we estimate that 60% of the uh, uh,
Population.
well, no, the
No.
population, the money
Oh.
of the payment, 60% of the payment that has to be done to get health services has to be done with out-of-pocket money, money of the family, money of the person, uh, and only 40% of this money comes from the government. So if we add this payment uh, to the out-of-pocket payment, we obtain a higher cost for the quality of life, uh, a better quality of life, and we get a higher cost for the health of the Mexicans.
Well,
Um,
let me see if if I'm saying this correctly. The vaccines provided right now, COVID-19 vaccines provided right now by the Mexican government, are they basically useless? I mean, why would why would you get a vaccination of if it just doesn't cover, it doesn't provide you any coverage for at least the threat that COVID presents right now. Is that correct? Am I saying that correct?
yes, they are like well, the group of experts of the World Health Organization on March 2023 justified the substitution of original virus Wuhan from all the vaccines to be updated to the XBB.1.5 because of true reasons. The original Wuhan virus is no longer circulating in humans. The second is vaccines made with the original Wuhan virus currently generate undetectable or very low amounts of neutralizing antibodies. The neutralizing antibodies are the antibodies that had the ability to inactivate the virus once it gets in the body with the circulating variants. And the third reason is that combining new material from new variants with material from the original virus, the ones that called bivalent, bivalent vaccines, reduces the magnitude of the expected protective response. So for these three reasons that gave us a committee of experts of the World Health Organization, the now updated vaccines of Comirnaty and Spikevax for Pfizer and Moderna are the ones that had to be delivered to the Mexican population, and not the ones from Abdala or Sputnik or AstraZeneca that are not updated.
So let me ask you this then. We have what has then happened with COVID? Has it become less dangerous? Is that why people are not getting as sick as they did when it originally appeared? Or is it that even the old vaccines, the vaccines that cover the original, the original threat presented by COVID-19 provide some coverage? I mean, what is happening with COVID-19 in general?
Well, COVID-19 in all the world has been circulating like an endemic disease. It is now a part of the epidemiology of the respiratory virus, but it's considered still a very serious disease because it caused us a pandemic, but also because of, despite the high levels of vaccination and infection in the past years, it continues to affect millions of people around the world, causing complications and health. Recently, in the US and in Mexico, there has been a high amount and increase of COVID-19 cases, and not only cases, but complications of them, hospitalizations. The health sector is becoming a stressed sector once more. So we can say that the COVID is targeting other populations, other risk groups among the society. The highest risk factor for developing severe disease and complication continues to be the age. Adults age 65 and over are the most vulnerable group. So we have to put emphasis in this group of population to be updated with an immunization shot of COVID-19, as well as some medical or health conditions and pregnant women. So if we add to this circulation the influenza virus, we obtain, or we have to multiply by 4 the amount of risk for being hospitalized because of a co-infection.
But people are not, I mean, at least the numbers we have right now from the Mexican government, from the Ministry of Health, at least here in Mexico, people are getting sick, but it appears that the problem is influenza, seasonal influenza, and not COVID. They're not going to the hospital as far as the numbers show, or am I wrong?
There are underdiagnosed cases of respiratory disease are underdiagnosed because the COVID-19 PCR tests are only done in 10% of the ambulatory population that are seen in very few units, medical units, and health community centers. And they are also done for all the hospitalized patients. So we are not seeing the full photography of the disease now. We are only seeing one little part, a 10% part of this full photography. So we have to take care. We have to get an update shot of COVID-19 by Pfizer or Moderna, Mexicans, before the peak of respiratory virus gets in the high proportion of cases in the climax. That it will be by the third and the fourth week of January 2024 and the first and second weeks of February. So now is a good time to get the shot of influenza, but at the same time of COVID.
So, if we assume that there's just simply not going to be enough vaccines, COVID-19 vaccines that protect you from the latest strains, and that the only vaccines available are going to be these vaccines that the government's providing that has the original Wuhan strain, that basically the World Health Organization has recommended that they not be used anymore. But that was a decision by the Mexican government. Can we expect that we may have a crisis coming in January and February, assuming that a lot of people are not going to have the booster shots, or they're not going to have these vaccines with the that provides protection with the updated COVID-19 strain? Or should we just continue to be concerned about what's happening with influenza?
No, it will be a crisis for selected groups of a high-risk population. A crisis for the 65 years old people, over 65 years old, and a crisis for the millions of Mexicans that have medical conditions that put them on high risk of hospitalization, complications, and that. Uh, who, uh, who are the ones that will be in higher risk of the severe disease? Well, cerebral vascular diseases, that it's a complication of diabetes, it's a complication of hypertension, chronic kidney failure, that is a complication of diabetes, a very common disease in Mexicans. Chronic respiratory diseases, also HIV, heart diseases, mental health disorders. Obesity is one of the high risk factors that is seen to multiply the risk of COVID and complications and hospitalization. So Mexico is one in the top 5 of countries that has the obesity phenomena increased. So yes, it will be a problem, but a sectorized, a focused problem.
And what else? I mean, you're head of the travelers clinic at UNAM University. Any advice for our audience as we head towards this holiday season? Everybody's traveling, and there's a lot of traveling during this period.
Yes, I think that travelers had to put attention in their vaccines, the update of vaccination schedule, because influenza is considered one of the of of the top diseases that affect travelers. First is gastrointestinal, second is dermatological, and third is respiratory disease, being the first cause the influenza virus A and B. So if we are going to travel along the country or around the world, we have to get a shot of influenza and also a shot of COVID-19, because some of the travelers have high risk factors for severe disease of COVID-19. And we all know that one of the risk factors is traveling, traveling around the world, because the virus travel with us. So we have to get the shots. We have to get a preventive measure that lowers the risk of being infected during our travels. And it's very fast and secure, the methodology or the steps to get the shots. So uh, an advice, a health advice from your travel medicine clinic at UNAM will be this one.
Mm. Well, I really appreciate you joining us, especially now as everybody's trying to figure out, you know, what to do in terms of this, these options of trying to get your vaccine. And of course, I think people, if they have the money, they will and try get this COVID-19 vaccine that is now being imported to Mexico from Pfizer. The problem is it appears that at least right now there's just not enough for those who want it. And I guess the other option is just to take the other vaccine provided by the government, which seems to not provide very much coverage, but it is what it is. So at least get your influenza vaccine, I guess, is kind of the summary of your recommendation. Is that right?
Yes. And let's
Okay.
get a shot, the influenza shots, or
Mhm.
if you can, the COVID-19 shot also update.
The updated one, the new book. Okay. Well, I really appreciate you joining us not only today, but throughout the years, especially when this crisis, COVID-19 crisis started. It's a different world, but there's still issues that we need to be concerned about and address them and take the steps necessary to try to stay healthy. Dr. Jorge Baruch Diaz, it's always great to have you on the show. Thank you so much for joining us.
Thank you very much. Have a nice
Thank you.
holiday.
Thank you. Thank you very much. We're going to go to another commercial break. I'm Ana Maria Salazar, and you're listening and watching Living in Mexico. Don't go away. I'll be right back.